A journalist and breast cancer survivor comes to Cincinnati to help raise funds for a comprehensive women's health program at Bethesda North Hospital. Joan London is the keynote speaker tomorrow night at the annual Bethesda Lyceum. She'll be at the Horseshoe Casino. Now, she's here to raise awareness of a few things all women should know to stay well, so we thought that was a great time to ask the experts at TriHealth to tell us more about these in today's Medical Edge.
Rindy Walton makes regular visits to see her women's health provider.
Because I think just the regular checkups are so important. As uncomfortable as they are, finding out about things when they can be treated, or even having that peace of mind that, okay, nothing's wrong.
That is a good decision, Dr. John Fackler says, especially because Mindy lost a sister at a young age to breast cancer.
She was diagnosed at age 28.
Because of this, it's important, Dr. Fackler says, that she get regular mammograms. But he points out,
unfortunately, the vast majority of women who are diagnosed with breast cancer don't have a family history.
That doesn't mean, however, you should feel helpless.
His message is really a simple one. There are a couple things you may not know about that make a big difference in your future health, and they are things all of us could do on a regular basis.
For example, he says many women get mammograms.
However, about 90% of women find their own breast cancer. It's not found by a doctor or on a mammogram. And those folks find those cancers through breast self-exams.
Dr. Fackler says that several other tests, from blood pressure to pap smears, can also detect problems early enough to intervene.
A pap smear is designed only to find the changes that could become cervical cancer. Our goal is not to actually diagnose cancer. Our goal is to diagnose the changes that would become cancer over time, again, so that we can intervene.
The team here says it's important you ask about screening and lifestyle recommendations that change with age. Andy Swallow is working with the team on a comprehensive women's health program because...
And studies show specifically as women move beyond child-rearing years, their medical needs and concerns are distinctly different than those of men.
Now, we always invite your questions for providers at TriHealth. Just go to local12.com, click on Ask the Expert. We have a link there as well to the Bethesda Foundation and that dinner with Joan London. One of the really interesting things is they're trying to pull together something based on research. Women are not just little men.
Right.
And so we often do studies on guys, for example, with heart disease, but women, that's our #1 killer as well. So if you don't separate that, we don't get treatments that we know are right for us.
It's like children and adults, they're different. You need different kinds of research.
And you know what? You rarely can do something on kids because it would be unethical to say here, unless they're already sick. And that creates different therapies and different unique problems. So I applaud them for saying we're going to try to pull together some resources. Joan London will be here to speak for that. We'll share more on that tomorrow.
All right.
Thanks, Liz.
Thank you.